All right. Hi, everybody. It's so nice to see everyone and some familiar names and all that. I'm going to jump in and get us started. We are recording this so we can totally send it to folks after, and it'll be kind of in our post workshop email as well. And so I know a lot of people have things pop up, lunchtime and all that, but I want to jump in so we give Alex and Devon all the time to share all of the community engagement things they have with us. So I'm going to kick us off. My name's Allie. I am a fifth-year clinical psychology PhD candidate here at Rutgers, and I'm super excited to be helping Dr. Jessica Hamilton with the Rutgers Addiction Research Center's SciComm work group this year. Dr. Jessica Hamilton is an assistant professor in the Department of Psychology, and she's not here today because she's currently on maternity leave, so very exciting for Jess. But she does a ton related to SciComm. She really brought an initiative to our clinical program, to the psych department, and then we've been fortunate enough to work with the RARC to really expand this throughout Rutgers. We included her lab website on the welcome slide, so I definitely encourage you to check out the Hamilton lab. She posts lots about community engagement work, their advisory boards, and all that stuff that's super related to what we'll be chatting about today. And just before I introduce our speakers, I just want to give a huge thank you to Dr. Danielle Dick, the director of the RARC, for all of your support and dedication to SciComm. It's very rare that we have so much university support for something like a SciComm initiative, and it's been so wonderful to get to work closely with you and with Ricky for being able to put on these great workshops. This is our second one this year, and it has gone so smoothly and so wonderfully, and it's absolutely all thanks to the RARC, so we're very appreciative of all of that. Okay, so just a quick little bit about today, and then I'm going to turn it over because I'm excited to listen to these speakers for sure. So if you haven't taken the pre-workshop survey, Ricky put up a QR code on that slide. If you can just scan it and just take that for us. Obviously, we're researchers. We love data. We like to know like these things are actually answering your questions and advancing knowledge in certain ways. There will obviously be a post survey as well that we'll send out in the email. But let's just jump into it. So we have two speakers today. We have Dr. Alex Bauer and Devon Ziminski. They're going to chat about the principles and practices of community engaged work. So to start off, we have Dr. Alex Bauer, who is an assistant professor in applied psychology in the Graduate School of Applied and Professional Psychology. She's also on the executive board of the Rutgers Addiction Research Center, representing diversity, equity, and inclusion, and is the director of the Racial Equity, Advocacy, and Community Health Alliance Lab. I would definitely also recommend checking out their social media and website as well. It's great. And Alex's research focuses on engaging directly with communities in helping improve health and well-being, sorry, and addressing social determinants and improving mental health treatments and resources. And then we have Devon, who is a senior research administrator at the Senator Walter Rand Institute for Public Affairs at Rutgers Camden. And she's a PhD candidate in the Rutgers School of Social Work and an affiliate with the New Jersey Gun Violence Research Center, where I'm also an affiliate, so I get to work with Devon a little bit, which is wonderful. Her experience has focused on the intersection of social policy and research, and she's currently leading multiple research and evaluation projects in social services and violence prevention spaces, especially in Southern New Jersey. So I'm going to turn it over to you guys. If you guys have any questions throughout, feel free to put them in the chat. We hope to have some time at the end to answer. But without further ado, Devon and Alex, go ahead.
Thanks, Allie. I'm just going to get the slides up here. I think everyone can see that. Yes.
Well, thank you so much for that great introduction. I do have a little bit of a cold, so I'm sorry if you can hear my sinuses a little bit. Again, I'm Alex Bauer. I'm very happy to be here and be talking about this with Devon and on behalf of the RARC work group. Our first question, Devon, if you don't mind going to the next slide, is just to kind of gauge from everybody in the audience your experience level with community engaged research. And this could be if you want to type in the chat, if you want to unmute yourself and kind of comment on it. What's your experience with this? So never done it, some experience, a lot of experience. And then we're going to ask in a couple minutes about interest and kind of some of the things that you might be interested in doing in the future. Awesome. Okay, so some experience, a lot of range, which is great. Some people saying some experience, but I know key buzzwords. So like community-based participatory research, we'll definitely talk a little bit about that. Um, I think some experience, but again, somebody said that they could always do better, that advisory boards, but overall very little. And I think there's always something more that we could learn. So that's one of the things that we'll talk a little bit about today, is how that this, I think, process is kind of iterative and that we'll continue to learn as we go. Awesome. Anything you want to comment on, Devon?
No, I'm just agree with you, excited to be here today because there's a lot of, as people have mentioned, buzz about different ways to involve community engaged research. So we're excited to talk about it.
So I know Ali mentioned this a second ago. We just wanted to kind of introduce the idea of SciComm. Hopefully some of you were able to attend the last work group meeting, but really this is a new initiative, again, that was spearheaded by Jessica Hamilton and Ali Bond. And we wanted to kind of give, because this is going to be recorded and we know that these resources are going to be distributed, make sure that we're really plugging that work group because I think you guys are both doing incredible work. And this is something that is so important that I know I am kind of learning and trying to integrate more into my work as we go. And so we mentioned like social media and things like that. And those are all things that, again, I am trying to kind of be better about in terms of disseminating our work to broader audiences. So again, science communication is definitely something that we'll talk about today, as well as how we can kind of tie that into community engaged research approaches and then kind of, like I said, disseminating our work to broader audiences.
Great. And then in terms of goals today, always good to have a little bit of a grounding space for why we're all here, hopefully. Really, there's so many avenues that this presentation, when we were planning it, could have gone in. So we really just wanted to provide kind of like an overview of what's community engagement, what does that look like at a university, what is community engagement and research, and what does that look like at a university, and how can it be done? And then as Alex was saying, thinking about opportunities for disseminating that through a SciComm approach. And then also for people, on this call, I noticed there were people in the registration, both within and without Rutgers, to meet new people that are also interested, maybe in the same content areas, but also in these types of methodologies. And so I'll turn it back over to Alex to kind of frame us in what do we mean by what we talk about when we say community engagement, and then I'll jump back in to talk about that framework in research.
Yeah, so I think one of the big questions is really around kind of what is a community? And one of the things that I talk about in my community psychology course in the first week or two is that, what I think of as a community, as someone from outside of that group might be totally different than how someone within that group would define it. And so at its kind of basic definition, we think about people who have a shared history or priorities or some kind of cultural background. But that can exist in a lot of different ways. That can obviously be kind of larger macro system level if we think about, maybe westernized societies or westernized communities. Localities, so the regions that we live in. I have moved all over the country for grad school and internship and things like that. So there's very different communities that I've kind of either been a part of or been adjacent to throughout my professional career. All the way down to kind of the organizations that we are in, the microsystems, or maybe the interpersonal relationships that we exist in. And so there's a lot of different, obviously, possibilities for defining communities, depending on what we're interested in. And I think one of the things that is important to consider is that where are the borders or what are the boundaries of those communities? So again, as someone from maybe outside of a given community, if I'm saying that I want to study this population or engage with this community, my definition of that might not necessarily fit exactly with what the people on the ground are saying, right? And so it's really important before we even talk about community engagement and ways of doing this kind of research, to really understand the history and the, again, priorities and values of that group. And then understanding the ways that that kind of impacts their intersectionality as well. Certainly, we know that individuals exist within multiple communities, multiple forms of identity. And so there's a lot about intersectionality we could touch on, but I think that's something that is just really important to highlight, that the researchers are not deciding what that community is. And also that communities are always changing, that the certainly priorities can shift, cultural values can shift, the kind of borders of the definition of that can shift. So it's important to kind of always kind of keep an eye on how are we defining it, how are we looking to others to define it, and really kind of learning in a reciprocal way. Anything you want to add, Devon?
No, I'm good. I'll go to the next slide if that works.
Perfect. So before we go forward, we wanted to just ask, what communities do you belong to? And again, kind of all across the spectrum of what the types of things we mentioned. And what communities do you do research with and among? So if you can scan this with your phone, and you can do this on obviously on a device, or if you notice above the QR code, there's an access code. If you go to menti.com and enter that, you should be able to answer these questions. Okay. And Devon, do you mind if I share my screen real quick? I can just share some of that response.
No, all good. Let me stop. I'll stop.
Perfect. So you can see that, we talk about our gender identities, our professional identities being a part of the research communities and academic, and then our more closely held identities, right? So being part of the queer community, part of the LGBT community. And so there's a lot of things that we are bringing to our work and to the ways that we ask questions, to all of the ways that we kind of move through the world. And especially, I think, when we talk about identity and things like that, we tend to focus, at least in research, I see a lot on race and ethnicity and things like that, but we know that there's so much more that's important in terms of our, like I said, gender identity, age or generational affiliation, our religious or spiritual beliefs, body shape and appearance, and our physical health, and all of those things that can make a difference in how we are interacting with the world and how others interact with us. And so I think that's a really important place to start. So I'll stop sharing, and we can go back to the next slide. Perfect, thank you. So generally, we wanted to talk a little bit about kind of what are the forms of community engagement and what does that look like. There's a lot of different, I think, kind of a range of ways that we can get involved, or ways that we can start to engage communities, from involvement in programs and service delivery, and things like that, but then also in a more active kind of research component. So what we'll talk about in a second is community engagement in research, but just more broadly, kind of thinking about community engagement and what does that mean. There's lots of different levels, again, for having external folks contribute, for the community getting involved in your activities. So, for example, having students involved in service learning or programming, having other kind of community members involved in planning and operations. And so I think it's important to note that, especially kind of across the maybe sometimes more protracted process of research, that there's different levels of what's feasible for researchers and for communities. And sometimes our opportunities are limited. And so I talk a little bit about that with my students, that if you're doing one paper and maybe not going to be involved in research very long, or there's maybe limited opportunities for you to kind of stay in that area, that sometimes it can be really tough to kind of have that personal connection and to develop a really strong sense of community engagement. And so I think it's important to note that this is a spectrum. So this is something that people can continue to build over time, that we can continue to kind of deepen some of those relationships, and certainly those partnerships as we continue to work together. And then certainly, again, being an early career person myself, I'm kind of in that process, right, of learning who my community partners are, who is doing what in this area, learning all the people who are doing really incredible work already, and then how can we amplify that or help to kind of have a mutually beneficial relationship. So I think it's really important, again, to kind of give yourself a little bit of room just to learn about, how can we go through this process of outreach through consultation up through kind of shared leadership, and really actively kind of collaborating with partners and communities.
Great. Thanks, Alex. And so then we're kind of going to transition into, okay, taking these principles of community engagement, what does that look like in research? And we thought it was important just to note, even for me, anytime I'm reading something or doing something, people even mention it in the chat, there are a bunch of different terms that, people in the academic world like to throw out there when we're talking about community engaged research. These are just some of them. If anyone has other ones they've heard, throw them in the chat because I will add them to this list. And depending on what type of community engaged research you're doing, for example, if you're working with youth, you may use different terms, and then some of the different methods, which we're not going to get into today, but it's just good to kind of understand that under these practices, there's really, an umbrella of terms that are some different, some kind of meaning the same thing. And that really their goal in doing this type of work, as I'll get to in a minute of defining it, is to really just find ways through research and communities to increase health equity, reduce disparities, and promote general well-being in across population health. I don't see any other terms in the chat. So, but if there's others, please add. So really, what do we mean when we say, okay, community engagement? If we think about community engagement, just generally like at a university, like some people may have been involved or are involved in like service learning projects where maybe students are, as Alex said, going out to do something like their volunteer work or working at different community-based organizations. But really the distinction when we think about community engagement and community engaged research is moving away from that direct involvement in service delivery. And in addition to that, having a research component and working in collaboration and in partnership with community researchers, community leaders, community residents in some type of informal or formal academic study, community study, research endeavor. And again, that can look a lot of different ways in a lot of different places. And it does always look different depending on who your partners are, where you are, or what communities you're a part of and who you're working with. And as I talk about principles in a second, one of the main things with research and community engagement is to just be intentional about it. And this is kind of a thread throughout the whole presentation, is having that transparency and making sure that the goals, as they should be shared amongst all parties, are intentional and that they're framed from more of an asset-based perspective to being relevant to the communities, not being invasive, not having this, white saviorism ideas coming in, being respectful of community people, places, and spaces. And so that kind of goes into the principles of what we mean and what we apply when we're using community engaged research. And Alex and I can provide a little bit more examples in a few slides once we talk about, the work that we do within our research centers and our projects and partners. But really the 6 main principles are starting with shared goals and values. And so this is really important. Thinking about transparency is the idea of, okay, if you're a researcher, you're just like, well, I have this grant, so I need to get community members. Versus, okay, if you are already working with community members and you come up with this idea and they come up with this idea, what is the goal of that research? What's the goal of applying for a grant? Or even from the beginning, just taking it a few steps back, having that engagement and just being really clear about that. Which kind of goes into the second principle of having those trusting relationships. Again, whether it's starting a new relationship or maintaining a relationship, or even times when a relationship may need to end for whatever reason. Having that open communication, for example, like a lot of things, needing to reach out to partners, something that I do a lot is being like, you know what, we're having some delays, let's be open about it and talk about how we can reframe, let's say, data collection or something. And then also, just again, in all of this work is the idea of equitable collaboration and making sure that decision-making is not really coming from, as it has been traditionally in the past, coming from, well, we're academics, we have all this knowledge, we're going to tell everyone what's going to happen and how things are going to go, versus really having a bi-directional and a not hierarchical decision-making process. And then another principle is the idea of really focusing on community strengths. And this goes to when we're talking about just like, you know, in manuscript writing, but then also in the actual act of doing the research is, and I've said this, you know, framing things from an asset perspective and looking at when you're working with communities, what are the things that they are focusing on that make all these communities wonderful places to work, to live, to play, to worship. And kind of framing projects within that mindset. And then the last one, I won't talk about accessible findings yet because we have a whole couple slides on dissemination and SciComm. But then the last principle is, again, the idea of collective benefit and really thinking, just because it's something that maybe you want to know as a researcher, well, what are things that would be beneficial for community partners, community residents, in the sense of applying for funding or helping them gain information that they can then immediately implement within their programs, or ways that they want to reach out to different community members. So those are just kind of like guiding things within the whole spectrum. But then when we think about these principles within our actual research projects, I really like this graph. It's a little blurry, but I couldn't find a less blurry version. And there's many versions of this too, depending on what, you know, what articles you're looking at and things, but I have used this one a lot and I like it because it really shows the spectrum of community engaged research. And that whatever the project is, you know, as you move from left to right, there's going to be more community involvement. And not all projects are going to fit each of these perfectly, and not all projects are going to be able to be all things. And that's another thing that, you know, Alex and I can speak to from our own experience in doing this type of work is really with just that transparency. Like if the project really isn't community engaged, that's okay. But don't, you know, it's like the idea of don't say something is when it's not, because all of our research, all of our projects can't be all things to all people. And so just really leading with that transparency of, okay, maybe we did this research, you know, maybe we had these focus groups or disseminated this survey at a, you know, local addictions clinic, but that's a very different type of project than we're applying for the grant, we're designing our research design, we're doing our data collection in conjunction with people from that center or what have you. And then I also like that this graph shows, you know, some of the external factors that are, again, speaking to those principles around relationship building, transparency, and trust in this process. So I'm going to pause there for a second while we go into, okay, now that we have sort of the principles of the community engaged research, why do people either do it or why do we want to do it? Why should we do it? So I think if people want to put in the chat or feel free to unmute, or silently think in your head, that's okay too. Because in the next slide, I'll talk about it as well. But I'll give a minute if anyone has thoughts of, you know, why are you interested in it? Why Have you done it in past projects? Or would like to do it in future projects? Let's see if I look at the chat. I'll move it over here so it's not in there. Okay, thank you, Danielle. Can make our research more impactful and relevant, grades more accurate data and representation of the topic, addressing community needs, making sure Allie's saying, you know, kind of translating the things we're doing in labs in the real world, in practice. Oh, okay, a lot of answers coming in. Identification of what matters to the community. That's a great point too about, you know, things that are community driven, what may be important to them may not be important to research questions that we have. Better representation of people involved with the work. Better implementation, that's a great point too for our implementation science folks. And yes, definitely the idea of sort of extractive knowledge and moving towards, you know, epistemic justice of who creates knowledge, where is it coming from, who's an expert, and what do we mean by that? Okay, awesome. These are amazing answers and definitely kind of speak to, again, here's just some examples, but a lot of you hit on them of why is it important to do this? Why do people do it? And some of the main things that we've just talked about are really trying to engage in research that values those diverse perspectives in the entire process, from coming up with study ideas to research questions to doing the actual data collection in partnership, and really creating those mutually beneficial relationships that allows communities and, you know, their academic partners and community members to co-create that knowledge that's going to be useful. And as I said, you know, we'll talk a little bit more about dissemination, but then really how can this information be used in terms of translating that research to action from the community perspective, you know, thinking about what's important for shifting program or maybe using this information to apply for funding. Because many community organizations are working already on a shoestring budget and don't have the disposable funds that universities do to just sort of take time to engage in things just for the sake of doing it. And really to find some of the answers talked about this too, having that nuanced understanding of, okay, how can we take this data or information and apply it moving forward in our communities? And so now, any other thoughts on that before I move on? Again, these are just some of the overarching, but there's so many reasons, but I'm also, you know, a huge proponent. So this is what I do all the time. So I'm happy to talk about it. Okay, if not, then what we'll do is we'll just move into a couple examples from the work that I do here at the Walter Vann Institute. And then Alex will talk about her work as well at Rutgers. And so just a brief background, there's a lot of text on this slide now that I'm seeing it. But I have a couple roles at Rutgers, and in my main role, what I do I'm based at Rutgers Camden at the Walter Vann Institute, is our institute is focused on research and evaluation that focuses on community issues that are specifically about our 8 South Jersey counties. And another reason I'm happy to be, to be working with this group too, is I'm always a proponent of cross collaboration between our Rutgers units in Newark, New Brunswick, and Camden. But our institute specifically focuses on issues that are relevant to South Jersey. And so it really enables us to kind of be nimble in when different issues are coming up. For example, we recently released like a transportation report, being able to go out into community and work with our partners to understand what's relevant to them, what do they want to know, and how can we then capture that information, translate it back, work with community to bring it back out, and then disseminate it in ways that are going to be relevant to our South Jersey legislators, our community nonprofit leaders, and then other folks at Rutgers and beyond who may be interested. And so here's just a smattering of some of our partners. We, at any given time, are working on like 15 to 20 different research or evaluation projects. And one of the things I love about the work here is that we're always, we have many long-term partners, but then we're always meeting new people when we're out in the community. And so here, just as an example, we have a bunch of healthcare organizations like Cooper, which is right down the street from where I'm at, Atlantic Care, Inspira Health here in South Jersey, and then many other kind of local nonprofits in the social services, substance use, domestic violence, violence prevention space. So I'll turn it over to Alex to talk about her amazing work with communities.
Thanks. So my lab is called the Racial Equity Advocacy and Community Health Alliance, or REACH Alliance. And I've tried to kind of steer away from the term lab, actually, just because I feel like that sometimes gives the connotation of a type of research that I'm not as heavily involved in, and I think sometimes can have the connotation of like you are coming to communities to study people and things like that. It's going to be very othering. So I try to, again, kind of work in collaboration, and I would say the three kind of main buckets of our research or main areas are promoting health and well-being for people in minoritized communities. We mentioned addressing and understanding social and structural determinants of health, and then improving mental health treatments and resources, especially kind of promoting cultural humility among mental health systems so that people have access to care that is really validating and kind of recognizes their identities and experiences. And so I can say that I guess a lot of my preliminary research and kind of how I've kind of gone through my early career trajectory to get to this point, I would say has been more community engaged. So we mentioned doing focus groups, doing things like that to kind of see like what are the problems, what are some of the needs that people are seeing in their communities, how can we best address some of those things, and then building up over time, like I mentioned, to kind of have an intervention now and intervention processes that are really grounded in community-based participatory research. So working with our community advisory boards, people who are from that community, who are really stakeholders in that area, who can actively kind of throughout the process from the beginning of grant writing through to implementation, tell us kind of what are they recommending, what are they seeing that we are doing well, what might be able to change to kind of make sure that it's more relevant and really going to hit on what we're trying to develop. So if you switch the slide, these are some of the community partners that I am working with kind of external to Rutgers. And so the Urban Health Collaborative and kind of their partner organization, the Community Corner, as well as NAMI New Jersey, actually are one of the partners that I'm working with for a needs assessment of individuals across the New Jersey area, focusing on Black and Latinx communities and really trying to see again, what are kind of the needs around mental health, but also around social determinants. So that way we can hopefully use the data to really design interventions to kind of build on some of the programming and the amazing work that they are both already doing, and trying to really kind of promote mental health and well-being across the New Jersey area. The First Baptist Church of Lincoln Gardens, and they're trying to build a trauma-informed ministry. And then Act Now, again, is a program within NAMI New Jersey that really focuses on African American and Black communities and trying to provide not just support for individuals, but also for families and people who are supporting others who have mental health challenges. So again, lots of ways that they are already doing the work kind of in their communities, but then I think finding ways that we can partner and make sure that it's mutually beneficial to make sure that we're approaching this from an intentional research lens. So the next step is that we just wanted to talk a little bit about kind of getting started in SciComm and community engagement. And maybe for the sake of time, we'll just go through a little bit of the next couple of slides. So I want to make sure we have time for questions and discussion. And so really our first question, and just again, this is something that I think is a continual part of doing this kind of work, is to self-reflect on, what communities am I a part of, what maybe personal lenses am I kind of bringing to this work, what assumptions am I making, all of those things. But then also, who are the partners that I want to potentially work with, or areas of community that I would want to engage with, and why do I want to do that kind of work? And so thinking about maybe who do I do research with now? Why do I want to partner or do research with those individuals and communities? Going back to the idea of considering who will benefit from this. Is it that I will write my papers and get tenure and things like that? Or that we are actually kind of giving something back so that the community is more empowered or, has more resources, has sustainable programming, again, so that we can be intentional about making sure that it's mutually beneficial and not just me kind of doing the research, getting my data, and then leaving and not leaving anything beneficial behind. So always really considering a lot of these things in terms of how getting started with community engagement. And if you'll go to the next slide, one of the first things I think it's helpful to do to think about is relationship building. And I think this is one of the tough parts because there's no specific roadmap to do that. But if you think about, how you build relationships with anybody, which could be your, colleagues in your department, people in your own personal life, your own communities. I think being able to just communicate, and Devon mentioned transparency earlier, I think is really important. The RARC, I think, has been great about trying to provide opportunities to connect with other people. And I know that the Center for Youth Social Emotional Wellness is having a lot of community engagement events as well. And so I think trying to take advantage of some of those things and those opportunities, but making sure that you are thinking about, all of the time and effort, certainly the I think opportunities that it can take to build those relationships, especially with communities that maybe are more historically minoritized or sometimes we say underrepresented, things like that, but that have been historically oppressed, that there might be more mistrust. And even if I'm from that community, my identity kind of as a Rutgers researcher has another kind of layer to that. And so making sure that we're just kind of approaching with humility, and having opportunities for community members to really make sure that we can build trust and that we are building some of those relationships over time. And obviously that takes other skills besides our research methods, our ability to design a study and conduct data analysis and things like that. There's a lot of other values and emotions and I think conflict resolution and social skills that are involved. And again, we talked about the idea of transparency. I think first and foremost, kind of having the idea of what are their goals, what are the things that we want to achieve with this research, making sure that we're both on the same page with that, as well as who's providing funding or financial support for the project, what are their purposes, what are maybe my obligations as a researcher if I have maybe a pre-existing NIH grant. So there's some things that are structured that we really can't change. But are there things that maybe we could shift and try to build in, if that's the case? So knowing kind of that stage of entry or entry point and stage of research, I think is really important, and just being intentional and kind of mindful around that. Ideally, the people who you're working with would be involved from kind of the beginning grant writing stage, but if they're not, again, I think being just transparent and being willing to talk about those things openly about, who do you owe reports to and when, and what are the kind of things that you're trying to describe in terms of outcomes. And then also not just entry point, but exit point. So is this going to be a long-term relationship? Are there, maybe limitations that I can't personally continue to carry on this work, but here's the team that can, or trying to kind of introduce them to, introduce community members to people who can do more sustainable activities, and just being on the same page about that as well. And I think being able to, again, have that transparency can hopefully help to sidestep a lot of these problems. But a lot of the, again, things to consider, I think, have been, it's important to also consider like a lot of the personal skills as well.
Awesome. Thanks, Alex. So then in the next couple, we have like 3 slides left. Again, this slide, similar to the last slide, could be an entire semester, entire year course about this type of work. But just briefly, just wanted to highlight during the process. Okay, so you're doing, you got, let's say there's you got this grant, you're working with X number of community partners. Just for each step of the research process, again, from, if we think about that spectrum and then like the research cycle, in each phase, the research question, research design, sampling, data collection, analysis, and then dissemination. How are the institutions, community members, how is everyone involved and how is everyone contributing at each step? And again, for each type of project, it might look very different. Like there's going to be, as I said, like some projects where community may or may not be involved in the research questions, but they're really heavily involved in data collection and analysis, or vice versa. And just kind of, as we both have been saying, like being upfront and transparent about that from the get-go, and then especially as you move towards the dissemination end of being clear about who was involved, how everyone contributed. And then just a couple notes too, and thinking about like sampling and data collection, just really being mindful with our community partners around not assuming like homogeneity and thinking about intersectionality when we're thinking about designing protocols that are gender neutral, that are culturally relevant, that are in different languages, and building in the time, because it takes a lot of time to do this, to make all those different protocols and meet with partners to understand what are going to be the best ways to disseminate things, again, whether that means paper methods or digital methods or a combination of both, and really carrying that thoughtfulness through each phase, which sort of leads us to dissemination at the end of, once a project is done, how do we think about, or if you're thinking about it before it's done, but let's say once all the data is in, how are we thinking about engagement in getting that information back out to communities that participated, that were involved, that led this process in ways that are accessible and actionable, and then with other researchers in ways that are not perpetuating stereotypes or harmful narratives, and then other ways that we can involve general public that may be interested in the topic and our policymakers. And so really thinking about, for each of our audiences, how we can tailor not only, what exactly we're saying, what are our takeaways, but how we're saying it, whether that's through different types of presentations or academic publications or not academic publications. And again, acknowledging contributions and making sure that it's collaborative. And Alex, do you want to chime in?
Yeah, I think some of the things that are important to consider here is that when we're publishing, especially in academic journals, certainly that's beneficial for us as researchers, right, to share with the academic community. But for community members, then if that's behind a paywall, they're never going to be able to see that research. Or if it's overly complicated and has a lot of jargon, then is that actually going to be understandable? And so certainly inviting community members into the research process, making them co-authors, all of those things, and giving credit, I think, where it's due, like Devon mentioned, is really important. But even more than that, really sharing back to communities so that we are able to get our findings out to the people who it's gonna matter to the most, right? Who are stakeholders in this type of research. And so I think, again, Devon mentioned kind of our academic or non-academic outlets. And I think those are important points to kind of see, like, who are the people that you are engaging with in research, and then where do they get their information? So certainly Jessica Hamilton, who does a ton of research or a ton of work with social media. That's something that I am trying to be better about, kind of working with young adults now. But I think there's lots of different ways, and obviously the SciComm work group will continue to build on this work. But lots of ways that we can think about to get our information out that will be, as this says, accessible and kind of open to receiving feedback. I just want to really quickly state too that we're, as part of the RARC initiative, the DEI initiatives, what we're hoping to do is to kind of create a platform or create an avenue where researchers can write maybe a 1 to 2 page summary of their research that will then be disseminated or be sent out to community organizations. And we can provide templates and things like that, but we're really hoping to provide an avenue for maybe researchers who don't do as much community engaged research to at least start to kind of engage in that process. and then also receive feedback. So are there things that we could change or improve in future work? What might we be missing in these types of studies? So that way, as as a organization or as the RARC, then researchers are able to start to engage with community members directly, and then they don't really have to reinvent the wheel on their own. There's a way that we can kind of provide support for that.
Great, thank you. And so to end, just because this is something that I think doesn't get talked about a lot in community engaged research, it's just like, go do this. But a huge component, as if anything, unfortunately, in this capitalistic society, funding and sustainability are things that we have to constantly be attuned to. And so just wanted to touch on, in doing this work, as I mentioned before, like really thinking about the timeline, because it takes, as we all know, it takes a lot of time to get grants, especially, sometimes I'm literally spending half a day making sure that a subaward is getting to our community partner. And in terms of equity, thinking about if we're not expecting, other Rutgers researchers to do work before being paid, why would we expect community-based organizations to do work without or before getting the money? So not only thinking about equitable compensation for people that are maybe involved in projects, but also just making sure that organizations are being compensated for that admin, organizational, supplying space time that other people are, typically granted from other funding sources. And then Alex touched on this too, just thinking about like the capacity for funding coming from larger like NIMH or NIH, NIJ grants versus some of those smaller grants that maybe are more flexible and more feasible to apply for. Like I know Robert Wood Johnson has recently done some more grants in this space, and there's an organization here in South Jersey called the South Jersey Institute for Population Health that really tries to focus on smaller organizations applying for grants and kind of not having a lot of red tape in doing that application process. And then the last two things are kind of what we've been talking about, is just thinking about if it is only a 1 or 2 year grant, what does that look like in terms of maintaining and carrying on the work and the relationship from that goal of the engagement, and just being transparent along the whole way. And so things to think about too, regardless of whether you're getting into this before a project starts or in the middle of a project or planning for another project, but just always keeping in the back of our mind of how does this work and serve everyone in a positive and collaborative way. So those are all of our slides. I'll go to our last slide has our information. Thank you so much. I think we're here until 1:15. So I guess we'll just stop now and open it up to discussion and any questions or comments. I can stop sharing this too in a minute.
Thank you both so much. That was so incredibly informative. I feel like I have so many thoughts of like where to go next. You really outlined it so wonderfully. Yeah, folks want to throw questions in the chat, throw them out. We can just kind of have it go pretty casual.
Maybe I'll jump in and start. Huge thanks to the both of you. That was really great. And one of the things that I loved that you emphasized was this, that there's a spectrum of engagement and transparency in everybody's, intentions and really, boundaries or constraints, right? And I was thinking of Alex, like, on your example where you're talking about, is this so I can get a paper and get tenure, right? Or am I really trying to get something into the community? And I was thinking, well, ideally both, right? In the sense that, of course, you're ultimately interested in working with this community, hopefully, so that you can also put together something. And I don't mean you specifically, Alex, I know where your intentions lie, but, when you're partnering, obviously you hope the intention is to benefit the community. But at the same time, you know, if you're a brand new assistant professor, like you do need to be thinking about, I have a time frame for this grant for getting papers. I do need to get tenure, because if I don't get tenure, then nobody's going to be able to do this research because I'll be out of a job, kind of thing. And so I really loved your thoughts about, you know, being transparent about those realities that we all have. And I wanted to ask you all, I'm curious if you've had to have some of those conversations and how that has gone about, you know, or even your example of like, okay, the grant funding ran out and now I have a new grant and now I have to be working on this other project instead. Or, you know, how have some of those conversations gone? I'm curious if folks have had experience with that.
I think that was one of the things I was thinking about as I was developing this, that, for instance, when I did my dissertation, I was in Kansas City. And so I knew I had a kind of countdown clock because I was moving for internship. So this is not necessarily a project where we can like continue to work and then I'm going to be the person to do the later intervention development and things like that. But I kind of talked about it as part of my lab that I was at the time, that this is something that, you know, groups are continuing to do. If I am able to do this work, kind of here's how I'm going to plug that back in, and certainly how it benefits me being able to finish the obviously my project to get my degree, but at the same time, kind of making sure that everybody again was paid equitably. That if I'm showing up to barbershops and things like that to do my data collection, that everyone's on the same page, that you know me, you're comfortable with me being there. And I think on the flip side of that, now that I have a kind of longer term partnerships that we're developing, I think being open about that and how it can be helpful for me to publish, but also again for researchers who are trying to do community work and are not really sure where to start. Some of the things that I've published on are, you know, here's the recommendations of what people wanted for mental health programming or for addressing trauma in their communities. And so I think having that as kind of a foundation for like, here's what people are saying, how can we build on that kind of where I am, or in the communities where I'm working, and really trying to kind of set a model for like, here's how people are doing this, here's a way that we can do this more sustainably. So that way, again, it's not just we're doing this in our community and it's invisible to other academics, but that really the way that we approach the research, I think, is shifting. Do you want to add to that, Devon?
Yeah, I think I'll speak to the part about your question, Danielle, about like if things are ending, kind of what you do. Is that kind of what you're asking? Like, how do you be like, all right, like we're not able to continue this on right now. So I will say, like, and what Alex was talking about too, with like long-term relationships, like that sometimes, like, for example, a project that I'm working on right now is an evaluation of like a medical legal partnership down here. It's affiliated with Cooper Hospital. And like 5 years ago, one of my other colleagues had worked on a project with them when they first started. And so we've kept in touch. And then last year we applied for an internal grant here at Rutgers to do that evaluation. And so from the beginning, if when we're, you know, working with whether it's an old or new partner, I'll be like, okay, this is either the grant or this is the potential opportunity. This is how long it would be, and to see if folks are on board with that. And if not, you know, what's going to be beneficial for everyone. But then even after, for projects where things have, you know, they have ended and we're not talking to them, just kind of seeing people around. Like we make an effort to go to events that aren't typical research events. For example, like there's always like a YMCA conference we go to and we see our, you know, partners from like the Food Bank of South Jersey and we're like, hey, how's it going? Or like when I see things, I email them to like partners, even if we're not working with them at that time. So that, because you never know, like things are always, and just to have that continued relationship management. So even if a grant is ending or a project needs to kind of part ways, it's not necessarily because you're never going to talk to them again. It's just because that's the process. And, you know, a lot of nonprofits that we work with that are small too, they're also on that grant funding cycle too for operational dollars. And so there are ways to kind of figure it out, making that again, like a real collaboration.
And I think also, just want to add kind of showing up when I don't have anything to ask. So if my community partners are doing something, or there's an opportunity to get involved with what they have going on, where I'm not necessarily benefiting from it, I think is a really nice way to share our resources and kind of really see like what are they doing on the ground, and try to, like I said, make it mutually beneficial. And hopefully as a result of our work together, or that partnership, even if it is time limited, there's something we're leaving behind, whether that might be, trainings, or, protocols or things like that we've learned to do or that we've established together. Even if maybe like grant funding disappears, or dries up, or staff turnover happens, that there's something that we are able to leave behind that is can be implemented into their day-to-day activities. And then I saw Christy's question in the chat about, are there situations when multiple researchers independently want to work with the same community, and how is that navigated? And I think that can be a question of capacity too. So how many things do you have going on? And like, I know some of the groups that we've worked with in the past, they are doing incredible work, but it's also they're stretched thin, because each of their staff people, each of their community leaders are being pulled in a lot of different directions to address different problems. And so trying to talk about that. And so what are some ways that we can, if we're doing some kind of work together, make it easy for them to implement or kind of build into their ongoing activities. And if they are working with a lot of different partners already, then what are some ways that we can collaborate, or make it, again, a little bit easier to institutionalize some of the practices, so that it's not just like adding on top, like layer on layer of demands for their organization, their time.
Yeah, thank you. And I'll add on to that too, like extending from that question, is some things that we hear and are very mindful of is people, like some of our partners will tell us, we literally got an email like 2 weeks ago. We're working with a different project in Salem County, which is one of our like south westmost New Jersey counties. That people are being oversampled, they're being oversurveyed. They're like, there's research fatigue, and so being mindful about that too, of like, if there's a certain, especially if it's like a population of interest that multiple researchers are trying to engage with, similar to what Alex was saying, like trying to understand the landscape, and then being mindful that it just may not be the appropriate time, because there are certain communities and organizations that have engaged with research, and for some that have had not a good experience, but then others are just like, we can't do another survey, like that's just too taxing. And that kind of goes back to the idea too about like extracting from the community and not always giving back, but also, thinking of who else is operating in that space and how to make it really, again, it really just goes back to that like benefit for all. And not being overtaxing in places where there's already, under not as many resources.
Thank you guys so much for all of those answers, and those were great questions. Thinking a little bit from like a grad student perspective, I know we all know funding is limited in terms of having like funds to then go out and do community-based participatory research, or any of those other buzzwords that Devon threw up on that slide. But thinking in grad school, like I feel like it's even a little bit more restricted if you want to start engaging, forming an advisory board. So how do you balance the ethics of maybe not having the funds to pay someone, but also really being invested in trying to create that community and that network?
I mean, I think it's a great question. And again, like everything is going to be a balance of, especially if you're a grad student and like you move from somewhere else, you're moving somewhere else. It's also thinking about ways to engage community. Like that doesn't have to be traditional research. Like I think doing volunteer work and serving on an advisory board for a nonprofit or other ways because at least in my opinion, like I don't think we should ask people to engage in research if we're not paying them. In like an equitable way, but finding ways as a student to support communities, maybe it is giving like talks or doing roundtables that you're offering that, I don't want to use the word service, but you know what I mean? Like going to and doing talks or things like that, or doing other types of just kind of more traditional community engagement and saying that, hey, this is something, framing it in a way that this is a community that I'm passionate about and work that I'm passionate about. But right now, because I'm a grad student, I'm not being paid for it. And so I want to build my sort of research portfolio to support that with grants, because this is something that I see my research heading in. I know it's like a vague answer, but I think kind of framing it in a way that, yeah, here are the limitations. That's just the way that the institution is. Is it ideal? No, but here's ways that I'm still contributing to this community that either I am a part of or that I'm building relationships with.
Yeah, and I think being honest about that and just saying, like, I wish I could pay you and I wish I had resources for X, Y, and Z. But because I'm a grad student and we don't have grant funding or whatever it may be, this is where I'm at. So this is what I'd really like to be able to do. And then oftentimes, you know, like Devon said, that there's things that you might be able to do to support their mission as well. And so it's less like a, here's, you know, you're coming to me to do this research and I'm paying you. But if can we collaborate, or can we, you know, kind of like a basically kind of trade services, like she said, that you can help me with recruitment or whatever this might be, and then I'll help you with, you know, XYZ, whatever other kind of mission they have. And so sometimes there's ways of, I think, having that conversation that just, like I said, just lays it out that I really wish I had the resources, but I don't to do that right now. But here's kind of what I'm hoping to achieve by the end of this. And then does that also fit with their values? Like, what do they want to be able to get out of it also?
That's so helpful. Thank you both so much.
I was going to say with that too, I guess having the humility around it that they might fully say, no, if you're not going to pay us, then we're not interested. And that's okay too. And to being able to know that some places might have a little more flexibility and others may not, and that's okay. And I think try not to take it personally that, again, Devon said, like, I wouldn't work for free, researchers wouldn't work for free, that's part of their professional identity, right? And so if we're paying them for their expertise and we're not, you know, paying them in that instance, then understanding that that's a limitation and we'll continue to work around it. But that's something that I think researchers can always improve on, is just being able to take it and kind of move on in that situation, if that's the case.
Awesome. Any other last questions? You guys timed this perfectly. Look at that. Plenty of time for discussion and questions. It's awesome. Well, I want to thank you guys both so much again, Alex and Devon, for this presentation, for all the work you put into kind of making sure that it was accessible to everybody. It was a very SciComm focused presentation, which we love. For folks still on the call, we'll send out an email after this with like a post workshop survey. I think the link to the recording will also be in there, but if not, we'll definitely get that to you soon. And we try to compile some resources and create an Excel sheet that also is where folks can go and like input community groups that you know about or who you have worked with, or if you're like, oh, I don't even know where to start, somewhere you can at least go and just start to try to track down that information. And as always, please don't hesitate to reach out to me with any questions. Anything that you would reach out SciComm-wise to Dr. Hamilton right now, feel free to send my way. And if I don't know, I will get the answer for you while she is away. But yeah, thank you guys so much again. I really appreciate it. It was wonderful to see you all.
Allie, can I add one more thing too,
Please,
before everybody
absolutely.
jumps off? Of relevance to this conversation is, you know, where my next meeting that some of us here are headed off to is that one of the things we're doing at the RARC is launching the research community partnership. And so it's going to essentially be an opportunity for individuals. We're going to roll it out first through the UBHC substance use treatment programs. But the whole idea is, how do you bring together researchers, clinicians, and the broader community, so patients and family members, friends, others who care about addiction, to create more of a community and bring us out of our silos. And so as part of that, we're thinking about, what can researchers offer the clinicians? Obviously, what can we learn from the clinicians? What can we offer them? What can we offer the patients? And then obviously we benefit when they contribute to all the research that we do as well too. So how do we give that back? And so I'll just mention, at thoughts as this, we're sort of in the nascent getting this off the ground. We have done it in collaboration with some providers and patient groups already, but we're kind of trying it and then hoping to grow it. So, this obviously aligns with the other work that Alex is doing and leading about how do we connect to community groups too. And so we've been thinking about, through the research community partnership, which, for those of us on here who are researchers, like we might think of as, and we originally called a research registry. And then in fact, when we talked to the community, they said registry feels like brings up all kind of negative connotations when it comes to substance use. And so we called it a partnership after talking with them, which we like better anyway. But we're going to be putting together newsletters with kind of research findings and other things that are of interest to essentially send to all the individuals who are signed up in the research community partnership. But I was chatting with Ricky, Alex, when you were talking about, and Allie building out other communities that it would be good to develop and nurture partnerships with, that might be something else that we could think about, like, is there information that we have as researchers that might be useful that we could push out through our newsletters, figuring out what else would be of interest that we might, be able to bring something to the table. And that might be one mechanism too, to think about as we're building all of these pieces of different ways of engaging the community through various routes. So just want to mention it to this group before I forget. And so it's on your radar, and any ideas, send them our way.
I'd like to keep me posted, because again, I'm always trying to bring Rutgers, Camden, and New Brunswick and Newark together. So let me know.
I would love to do that, Devon, and I'll file that away, because as I mentioned, we're starting small, because although I like to go big or go home, as anyone who works with me knows, I've also realized that like there's benefit to like rolling something out, working out the kinks before you continue to kind of grow it and roll it out on a large scale. But yeah, we don't have as many connections with Camden as I would like. And so I think there's a lot of opportunity for that.
Definitely.
Amazing. That sounds wonderful. There's so much always happening at the RARC. It's incredible, the work that goes on. And it's very cool when we get on these calls or workshops and get to just hear a little bit and how much overlap there is. So that sounds wonderful.
Yes. Well, the irony is the RARC is us. So all the great things going on is because of, I always say it's not a place, it's a community. It is this community that makes all those great things happen. So yes, thanks to you all for today. It was a great example of